This is probably the type of therapy most consistently portrayed incorrectly in media. I've yet to find even one example of this therapy done well on screen, and that's probably because it's also the type of therapy that is most negatively viewed. Hey everybody, for those that don't know me, my name is Sabrina. I'm a clinical psychologist, and on this channel I talk with you about Netflix series and films and the psychology that we can see in these series and films. You don't have to be a fan of any of the shows that I talk about in order to watch any of my videos. Today I want to talk about ECT as we see it portrayed in Yellow Jackets. For those who don't know and haven't seen the show, I'll give a kind of brief recap. No spoilers, no worries if you do want to see it. But in the show Yellow Jackets, a high school women's soccer team ends up making it to nationals. And so they are on a plane flying over to nationals. And as they are, their plane crashes and goes down. They land in the woods and they're not rescued until 19 months later. So over a year and a half later, and they have to do a lot of things to survive, a lot of traumatic things. And it kind of goes back and forth between back then and then present day, many years later, and kind of the effects that some of that is still having on them as some of that is resurfacing. And in season 2 of the show, we can see ECT used on one of the girls. This would have been shortly after she was rescued. And I'll talk a little bit more about that and why they use it and whether it's a correct use of it or not. So let's start with what ECT is and why they use it in this show. But be warned before we jump into that after watching this video, it'll probably bug you whenever you're watching TV series and films from now on and they're using this therapy incorrectly. And you'll definitely notice just how many series and films do portray this therapy in just a horribly incorrect way. So just be warned. ECT stands for convulsive therapy. This kind of therapy works by inducing a brief seizure in the brain by passing these electric currents, so electric shocks, into the brain. The idea behind this is that it can actually, these shocks can change your neural pathways and different kind of neurotransmitters to help alleviate symptoms of whatever mental disorder that you are using this to treat. So it's kind of similar to antidepressants, but much quicker. So people can notice a lot of relief in a quicker time frame than they would from medications or other therapies. If you've heard of ECT before and you're at least a millennial or older, probably the first movie that comes to mind is One Flew Over the Cuckoo's Nest. In this movie, we see the main characters, played by Jack Nicholson, who is in a psychiatric facility. He's a little bit too unruly for the staff's taste, so they decide to administer ECT to him, to basically shock him into submission, to make him more docile, more manageable. And so what we see is that he enters this room, and there are a bunch of people in the room because at least half of them are there to just hold him down while this therapy is happening. One of the nurses, she puts something in his mouth after briefly explaining to him what it is. They don't really explain at all how this therapy is going to go. And then they put the electrodes on his head and start to administer the shocks. We just see them administer one, but usually you get more than one in ECT. And because this shock is administered while he is fully awake, you see him seize up and he obviously looks like he's in a lot of pain. This is often how people think about ECT. So much so that as late as 2023, when season 2 of Yellow Jackets came out, we see this therapy done in almost the exact same way as we see it done in a film that's from the 1970s. Issue is, this is a horribly inaccurate way to view the present day use of this therapy that has been used to help countless people. So aside from entertainment value, why do series and movies keep showing this horrific version of ECT? And aside from film altogether, why does the average person still kind of think that this is how ECT is done? Well, in order to answer that question, we have to go back in history. ECT was first used on humans in the late 1930s and discovered by 2 Italian psychologists, and then it quickly made its way to the US and the rest of the world in the 1940s. It was created by studying how folks with epilepsy had their brain affected in kind of unique ways with these seizures that they would have, and how these unique factors could help in treating psychiatric disease. So a couple studies found how people with epilepsy, how there was some kind of antagonizing effect, some effect that would kind of keep them from having schizophrenia or help manage some of the symptoms that they would have maybe after they had an episode of this seizure. So in essence, they were seeing how these seizures, instead of just being a disease, can now be used as a cure. And like I just hinted at, it was thought that this type of treatment would have significant benefit in curing schizophrenia. The issue was schizophrenia at this time period was really viewed as a problem. Often people who had schizophrenia were thought to be incurable, and there was a lot of crowding in psychiatric facilities because at that time the view was you need to separate these people from the rest of society. You need to put them somewhere. So then there were a lot of people in these facilities, it was overcrowded, and they had to figure out a way to cure these folks and then get them back out into the world. And the more and more these facilities became crowded, the more and more the prevailing thought was we need to do whatever we can to cure these folks by whatever means necessary. So because of that, that led to the development of a lot of barbaric types of treatments that had little scientific backing, little research backing at their efficacy, and were incredibly dangerous and incredibly inhumane. And one of the ones I want to talk about in this video that is often lumped in with ECT for a lot of reasons that I'll discuss in a moment is the lobotomy. Lobotomies were foundational in shaping negative views around psychiatric treatments during this era, and so it was foundational in shaping negative views about ECT, because ECT originated as a psychiatric treatment. And often ECT would be used together with lobotomies. So either after getting a lobotomy, people would then get this electroconvulsive therapy, so they would be used in tandem, or before getting a lobotomy, people would administer shocks to these patients as a way to kind of subdue them. And this was confused for ECT because ECT uses shocks, right? So they must be doing the same thing to try to subdue these folks, when in reality, they really weren't. Now, lobotomies were used as treatment for primarily schizophrenia, but other personality disorders and other mood disorders, mainly treatment-resistant depression. And remember that one, especially for later. We're going to come back to it when we talk more about ECT. The first lobotomy was performed in a mental institution in 1935, 1936, and the first use of ECT was in 1938. So really not a good look for ECT to come on the scene just 2 years after lobotomies and claim to treat the same things and now be used in the exact same settings that lobotomies were used in. If you're squeamish, skip ahead by like a minute as I describe what a lobotomy is and how it's conducted. And don't try to be brave here. If you have a weak stomach, seriously skip this part. There were 3 different versions of the lobotomy. In the earliest version, the doctors would drill holes into the patient's skull and then inject straight ethanol, so pure alcohol, into their brain, into their frontal lobe to damage some of the nerve connections there. In the second iteration of the lobotomy, they would still drill the holes, but then this tool was enveloped to kind of manually sever the connections in the brain. And then in the final version, instead of drilling holes in the skull, they would go in through the eye socket to then get to the brain and use kind of like an ice pick to dig around in there and cut up the nerve connections. This procedure was done because at the time it was thought that psychosis and other mental health symptoms kind of in this bracket were caused because of some kind of physical malfunction in the brain. Now, that's not horribly incorrect, and for the 1930s, this was a pretty advanced thing to recognize with the type of technology that they had at the time, but they went really off the rails when they thought that they could cure this physical malfunction by severing the frontal lobe's connection with other regions in the brain. They literally thought they could do a hard factory reset on the brain. Like, they thought that after they did this, people would then wake up and they would be fine. But the effects were insanely varied. Some people did notice improvements and were able to be discharged from the psychiatric facility, or rather, I should say that the inventors, the scientists who created this lobotomy reported that people noticed improvements, but a lot of people got way worse or saw no improvements at all. Some completely lost their emotions, Some became completely catatonic. And then there, of course, were even some deaths. And I'm surprised there weren't way more deaths, that basically everybody didn't die from this kind of procedure. But despite the insane variability in this treatment's efficacy, it was widely adopted in psychiatric facilities, and the inventor of the lobotomy won a Nobel Peace Prize for it. From there, it really became a tool of abuse and control, because basically anybody in these psychiatric facilities presenting with schizophrenia or other severe mental health conditions were at risk for being lobotomized, sometimes even before they really tried their best to treat them in other ways. And as I'm talking about the lobotomy, maybe throughout your mind was going to what is one of my absolute favorite movies of all time, Shutter Island. In this movie, the psychiatrist mentions to Leonardo DiCaprio's character, Teddy Daniels, that he'll be lobotomized if he doesn't get better.
They'll lobotomize you, Andrew.
It's interesting, though, because this movie is supposed to be set in the mid-1950s. And at that time in our real life history, there was already a lot of growing scrutiny around lobotomies. It was getting phased out for more safe treatment, so things like antipsychotics, which, yes, I know there were a lot of issues, a lot of side effects and problems with antipsychotics in the past and even today, but a lot safer than, putting an ice pick in someone's brain and digging around with there, you have to admit. And because of the dangers of lobotomies in the 1950s, it was even getting banned in some countries. And in Shutter Island, we do see Teddy Daniels taking some antipsychotics, taking this medication, so it's unlikely that he would also get a lobotomy on top of that. But like I mentioned earlier, the lobotomy was used for a lot of treatment-resistant diagnoses. So in that sense, this movie actually does a pretty decent job in terms of trying to create this radical experiment so that Teddy can kind of wake up and, somehow cure his psychoses, and then using lobotomy as a last resort, which is kind of when it was invented, almost the way that it was intended to be used. So like I said earlier, ECT coming so soon after this type of treatment, the lobotomy, wasn't great for its reception. People didn't look at it too positively. But the idea was always for this therapy to be as safe as possible and to decrease the side effects, which is why when certain effects were noticed with the ECT, that they were changed very quickly. And I'll talk about what those are. So early in ECT, the side effects mainly centered around the idea of the person being conscious, so them being awake and them not having their physical state altered in any way. I'll explain what I mean by that in a minute. So when ECT was first created, when people would receive the shocks, yes, they would have these convulsions like these shows and films portray. And they were very, very severe. These people were really at risk of, and most people did, injure themselves. People would dislocate body parts, break their bones, etc. during these convulsions. Another issue with being awake was being aware of what was happening. I mean, you are in incredible pain, and it's also probably incredibly scary to see yourself seizing and your body convulsing uncontrollably, sometimes to the point of your bones breaking. And we see this in Yellow Jackets. And remember that this episode of Yellow Jackets, Season 2, it's the first episode in Season 2, that this came out in 2023. But we see this character, her name is Lottie. We see her given ECT, and we see her convulsing, and she is wide awake. Her eyes are open when she's being given this treatment. The thing is, you don't have to be a mental health professional to easily find out that ECT is no longer conducted this way. If you Google how to do ECT therapy, the first thing that comes up within the first few lines, it says that these people are given a muscle relaxer and they're put under general anesthesia. So they are not awake. Their eyes should not be open, and when they're given the shocks because of the muscle relaxant, they shouldn't really be convulsing or reacting to it. So rather than the depictions we see in Yellow Jackets or One Flew Over the Cuckoo's Nest or countless other movies and shows, these people during ECT should really basically be asleep and not really react to the shocks. It shouldn't be this interesting. Oh, and these improvements started being made to ECT in the 1940s, early 1950s. So even for the time period that One Flew Over the Cuckoo's Nest is set in, which it's supposed to be set in the 1960s, these changes would have already occurred to ECT. And so we should have seen in the film him administered some kind of muscle relaxer and then put under general anesthesia, so put to sleep. But at this time, like I said, the fear of ECT was really hanging on because of its connection with lobotomies, but also because of the abuse that we see in the Nazi Germany era. Very shortly after ECT was created, I mean like 1 year after shortly, Hitler gave a decree that allowed all German doctors to euthanize psychiatric patients that they thought were incurable, that they just said they're not going to get better. And only 3 years after, within 3 years of this decree, this was responsible for putting to death tens of thousands of patients. How they initially eliminated these patients was that they would give them lethal doses of drugs like morphine. But over time, since they were doing it so frequently, I just told you tens of thousands of people died within the first 3 years, they were starting to run out of these drugs, and in general, they're not cheap to get them. So they came up with a brilliant idea. They said, you know what? Let's put some extra electrodes into the ECT machine, and then they would quite literally shock the patients to death. So not only was this method easily available and way more cost effective, it also helped the patients were less suspicious of it, because over time they started to get suspicious that the drugs that they were receiving was doing something to them, was offing people. But there wasn't a suspicion with ECT when they thought, oh, I'm just coming in to get my regular therapy. And Hitler's decree had a huge impact in sparking the anti-psychiatry movement around this time, because the medications and the treatments that psychiatrists were giving were offing people, and they were doing this purposely, like I said, in a lot of cases. So I can really understand the lingering fear today. I mean, yes, these people abused and they modified these ECT machines so that they could specifically take people out, but they lied to these people and said, you're going to get treatment, when they didn't. And so I can understand today if your provider says to you, hey, we're going to do ECT, you're going to get this kind of treatment, being worried about that. And today there are still a lot of countries that have banned the use of this therapy, even in its safer forms. There was also another big problem with ECT, and something that people are often afraid of when it comes to this therapy, and that's noted memory issues. A lot of people were reporting that they were having severe and long-lasting memory disturbances. But even for that, pretty quickly on, things were modified with ECT to try to help with this side effect. And so, for example, the pulses, the shocks that you would get are much shorter in duration now, much shorter in length than they were before. And there's now an option to do unilateral stimulation, meaning on one side of your head you'll receive a shock versus having to receive it on both, because receiving it just on one has been shown to help more with the effects of memory. However, as you might imagine, or you might not, but I'll just tell you anyway, with the just receiving it on one side, it takes more treatments to get the effect versus two sides. So a lot of places, including US and UK primarily, will still administer the pulses on both sides of the head if there aren't as much concerns for memory. But maybe like for older people, they might not, but for people who there aren't really concerns potentially for memory, and for people who need to see faster results, then they'll often still use the bilateral. However, with current ECT, research shows that the impact of these memory effects should not last longer than 6 months. So the memory issues are expected to be temporary. I hope so far everything that I've said about ECT has been completely different from the things that you've seen and you've been believing in a positive way. And if your curiosity has been piqued about ECT and you're wondering whether it could be effective for you and whether you can see some benefit, let's talk about that. So ECT, pretty quickly, pretty early on, it was found that it was very, very helpful for treatment-resistant depression. And remember when I mentioned that earlier when we talked about lobotomies and how in the early days it was used as well for treatment-resistant depression? Again, another connection as to why people were wary of ECT. But that would mean, in most cases, these folks had already tried some other kinds of medication, so antidepressants, maybe even stronger kind of medications, mood medications, things like that, and they weren't working. And they likely also tried some other type of therapy, so things like CBT for depression, and that didn't work either. So often a provider wouldn't be mentioning it to you if you haven't gone through a couple of other options. And so you can kind of trust that if they are saying this might be a beneficial treatment, then it's more likely that you might actually need it. So to go back to the series in Yellow Jackets, what happens after they are rescued from the woods is that this character, Lottie, that she becomes mute. She doesn't speak. Now, she has a deep psychiatric history, so from when she was a child, she was started on some pretty strong, it seems like antipsychotics, some strong medications, and when she comes back from the woods, they kind of indicate, they make it seem like she starts taking them again, and it also seems like it's not quite working. We don't know, we don't get a good sense of whether they actually tried other therapies. They don't give us that information. It doesn't quite seem like that to me, but we truly don't know. But with the information we do know, it doesn't seem like they're using this therapy for the right thing. I mean, she is traumatized, and as a reaction to that trauma, has become mute. And so they're really trying to use ECT as a form of trauma therapy. Now, I talked about 6 therapies that can be used for trauma in the last video that I did on PTSD, and ECT was not one of them. While I guess it could be used for that, it definitely wouldn't be before trying actual trauma therapies, which it doesn't seem like Lottie received. It seems like throughout her whole life she's only worked with psychiatrists, and so she hasn't receive this type of therapy. Unfortunately, there's no burden or no law for filmmakers to create and portray these things in an accurate way on screen. But this inaccuracy and this fictional, entertaining world that they create that's inaccurate has consequences in the real world. So I hope this video today has at least helped you to look differently at this therapy and question how you're seeing therapy portrayed to you on TV. It's often really badly done. And most of all, I hope that if you really did need this treatment but were afraid to get it because of things that you've seen on screen or rumors that you've heard about it, that this video can really help you in taking that step and getting that help that you might need. You might be shocked at the improvements that you'll see.